Knock, knock. Enter the room. Provide for privacy. Hi, my name is Kylie. I'm going to be a nurse today. I'm just going to be gathering some health history from you and get a little information about what's going on. Can you first go ahead and tell me your name?
Jill.
Jill. And what is your date of birth?
March 21st, 1983, so I'm 32.
Okay, are you single or married?
Married, but there's some conflict there.
Okay.
Still married.
Okay. Can you tell me a little bit about your ethnic background?
Asian.
Okay. Okay, what is your religion?
Buddhist. I don't actively practice, but I still meditate about twice a week, I'd say.
Okay. And do you have an occupation, Jill?
Yes, I'm an accountant.
Okay.
So that's strong, unfortunately.
Okay, Jill, so tell me what brought you in here today?
I woke up and there was like one side of my face was drooping a lot, like my cheek and my forehead are numb. I'm drooling from the right side of my mouth. My eyes are drooping, so they're all irritated and red. They've just been crying constantly. Just numbness. It's just kind of worrisome because my grandma did have a stroke.
Okay. So you said this started this morning?
Yeah, when I woke up.
Okay, how long ago was that?
It's about what, 10:30 now. I'd say I woke up around 7, so about 3.5 hours.
Okay.
So
So you were experiencing none of these symptoms when you went to bed last
I
night?
felt completely normal, and I just woke up with it.
Okay. So you said started around 7 this morning. And was it like you woke up and had all these symptoms, or did you wake up and like the symptoms just kind of started progressing?
Right as I woke up, I noticed it. I
You
could
had
tell
all the
something felt weird.
all the symptoms. Okay.
And even it feels like half my tongue is numb.
Okay.
Like, literally a line down my face, and everything over here is numb.
Okay. So what side of your face did you say that was?
The right side of my face.
The right side. Okay, and you said it's affecting your eyes,
My
cheek,
eyes are all
tongue.
irritated.
Okay.
So, since I can't close it all the way, they're just dry, and I've had tears the whole day. Drooling from my mouth.
Okay. But
There's no pain.
There's no pain. Okay. But it's pretty centralized to just your face. You're not having any weakness in your arms. No.
It just feels puffy,
Okay.
and swollen. When I look at myself in the mirror, I can tell that it's definitely more
Right.
swollen.
Right.
When I don't move, it feels a lot better.
It's pretty nerve-wracking because my grandmother had a stroke and she had a lot of the same symptoms.
Okay. So you would describe this as maybe just intermittent or like continuous?
Well, I woke up with it and it hasn't really gone away.
Okay.
I've been awake for about 3.5 hours, but nothing's changed besides just getting more irritation.
Okay. So irritating, but no pain.
Yeah, no, not really pain, just it's uncomfortable.
Irritating, you said some numbing.
Like
Okay,
completely
numbness.
numb.
Other than that, I haven't really felt too crazy.
Is that centralized to like your tongue mouth area, or is that like in your cheek and your eye as well?
Yeah, and in my tongue, like it's split right down the middle.
Okay.
And even my forehead is numb.
Okay.
You know, like I have to keep myself on the couch just so I can see I don't feel any pain.
Do you know, you said you were concerned, since your grandma had a stroke.
a lot of work.
Do you think anything else could have caused these symptoms that you're concerned with?
No, I've really
Or-
never had any other neurological things except for when I was a child.
Okay. Can you tell me a little bit about that?
I had a seizure when I was 2 years old, I think, but that's
Okay.
because I had a pretty high fever. I think it was like 104, 105.
Okay.
The doctor ruled everything out.
Okay.
I like, it's not that, like, I could go to work, it's like, you know, it's not that intensive for me to work, but it's like, I can even stand up
Okay.
to
And you've
almost all of it.
only been having these symptoms for about 3.5 hours. Have you noticed any other associated symptoms? Do you have a fever?
No, I feel completely normal.
Okay. Any nausea?
No.
No vomiting.
I guess
Do you,
just anxiety.
yeah. Do you have any blurred vision at all?
I mean,
No.
just watering eyes, so.
Okay. Any dizziness?
Mm-mm.
No. Any fatigue?
No.
No. Okay. Are you like any, do you have any sensitivity to light in that one eye?
Not
No.
really.
Okay.
Just to see if it helps, and it has
You said you have had like a stress level change just with the onset of the symptoms?
Yes, and some marital conflict.
Okay.
And I guess, yeah. And work is pretty stressful.
Okay.
I also have a 3-year-old, so
Okay.
terrible twos don't end at 3.
Yes, yes, I understand that. Do you have any aggravating factors? Like, does anything seem to make it worse, or is it just like a pretty consistent?
I just notice it more like when I'm drinking because it's
Right,
just
yeah.
going out.
Okay.
And it's just uncomfortable. But no, nothing really makes it better. Nothing really takes the uncomfortableness away.
Okay.
I even tried like washing my face just
Uh-huh.
to see if it was just from sleeping weird, but nothing.
Okay. And has anything made the symptoms like a little better? No.
I try not to focus on it, but
Okay.
it's kind of all I can think about.
Yeah, so like I said, you've only been presenting with these problems for about 3.5 hours. Have you tried any treatments? You said you tried washing your
my
face.
Yeah, no. I have taken some aspirin.
Okay. And do you happen to recall how many milligrams that was?
325. And
Okay.
I took 2 tablets.
Okay.
And that was around 7:30.
Okay.
Maybe closer to 8, but
Okay. And that didn't seem to make any of the symptoms any better?
nothing.
Okay.
Still numb, swollen.
No heat applied to
I
your
guess
face?
just cold water when I washed my face.
Cold water, okay. Have you tried like massaging the face at all?
I mean, no, I just keep touching it.
Yeah.
Can't
Yeah.
feel it.
A weird feeling.
Yeah.
Yeah. Okay.
But it's not tender. I mean, I can't really feel it.
Right. Okay, and you said you're not having any pain, so I guess 0 out of 10 on a pain scale
Yeah.
for you. Okay. You're just kind of uncomfortable.
Anxiety
and-
on 10.
Yeah, yeah. So how would you say this has interfered with like your daily living activities?
I'm kind of embarrassed to go to work.
Okay.
That's why I came here so soon. Dropped my kid off at daycare, and then I just wanted to come in and make sure everything was okay. My boss
Okay.
was okay with me taking off.
Okay. Did you try eating any breakfast this morning? Did you have trouble chewing up your food with the numbness in your mouth?
Yeah, I felt like it just kind of like pocketed in my mouth. and
Okay.
Just, kept biting my tongue, so I just gave up on it.
Right.
And drinking water, most of it just came out.
Okay.
No.
Have you had any exposure to any chemicals or toxins or infections that you're aware of?
I just work in an office job.
Okay.
At my last physical, they did check me for all that stuff. They came back.
Okay. And And how often, when you do take aspirin, how often would you say you take that?
I think the bottle said every 6 hours. So
Okay.
if y'all recommend it, I guess around 2 p.m. I'll take it again. But my first dose was around 7:38.
Okay. Do you know of anyone else that's having any of these similar symptoms?
No, just
No.
my grandmother.
Okay.
But that was.
But
years
no,
ago.
no one currently.
No one around me.
Okay. All right, I'm going to go ahead and just ask you some questions about your past medical history.
Okay.
How would you describe your general health and strength?
I mean, I feel healthy. I know that I could do other things to make me healthier, but I feel healthy. I'm not really sick ever.
Okay.
Okay.
Did you have any childhood illnesses?
No, just that one seizure from when I had
Just
a
a seizure?
fever, yeah.
Okay.
I think it was 2.
So no history of asthma or chickenpox?
Trying to remember.
No prescriptions, nothing like that.
No.
No, I don't think I had anything as
Okay.
a kid.
Do you have any current medical problems right now?
No.
No. No chronic diseases? Okay. Have you had any recent non-surgical hospital admissions?
No.
No.
Well, I grew up
Have you ever had
Christian.
any surgeries?
I really close to
No.
being a Christian kid, so, just.
Any serious injuries?
That's the big thing, really.
No, I've never had any trauma, especially to my face, brain,
Okay.
or my back.
Okay.
That could affect it.
Right.
And they said when I did have the seizure that there was no damages from it.
Okay. Are you currently taking any medications other than the aspirin?
I mean, not medication, but I do take my multivitamin every day.
Okay.
Oh, yeah. I know that the Lord's with me 24/7, 365 days a year. 366 if I'm on a leave.
And you said you take that once a day?
Yep,
Once a day?
in the morning.
Okay.
And if I forget, I just take it at night.
Okay.
It's helped me realize, especially like with this,
No home remedies or any other
it's
supplements
definitely
besides
made
the
me feel better.
multivitamin?
No.
I'm in my
Okay.
right mind.
Do you have any allergies to
Yeah, I can definitely
medications or
say that.
food?
No allergies.
No allergies? Okay. Have you ever had a blood transfusion?
No.
No? Okay, and have you had any recent health screenings? Cholesterol, a pap smear, mammogram?
I did just have a pap smear
Okay.
and a breast examination. My doctor did it.
Okay,
And then I went to the dentist, I'd say in January.
okay. Everything looked good there?
I haven't had my vision and hearing tested in a while, but
Okay.
if no changes have been.
Okay. And how would you describe your emotional status?
I'm definitely very stressed and anxious.
Yeah.
I'm missing work. This is just a new job. I started it about two months ago, and I'm still on probation for the next 1 month.
Okay.
And I'm just stressed about this appointment because I don't have any health insurance at the moment.
Okay. Okay, and then I'm just gonna ask you a little family health history. Just anything that you could give me is helpful. If you can't remember, it's okay. Can you tell me a little bit about your father's health history?
He was pretty healthy.
Okay.
Just hypertension and high cholesterol.
Okay.
And he is 72.
Okay. And how about your mother?
No, she's really healthy.
And how old is your mom?
70.
Yeah,
Okay,
they
and you
said
said you had children?
Just one,
Just one?
3-year-old daughter.
Okay,
And she's all healthy.
okay.
Doesn't ever get sick unless it's something spread at the daycare.
Right, yes. And do you have any siblings?
No, it's just me.
No? Okay. And then, any relevant medical history with any of your grandparents that you would want me to write down?
It was my maternal grandmother.
That had the stroke?
Yes.
Okay. And do you know what age she was when that happened?
I want to say she was late 60s,
Okay.
early 70s.
Go.
Any other history of stroke?
I'm sorry.
No,
Family?
just her.
Okay.
Okay, now, something that is appropriate.
Yes, I have another.
Okay.
No, my doctor says. it's
Okay, now I'm just gonna ask a little bit about your personal and social history.
Yeah, I got my.
Where were you
vision
raised?
supposed to go. Hearing it's been a bit.
In Dallas, Texas.
Okay.
You've gotten dental work assessment.
It's been about 5 months now.
And I was born there too.
Okay.
Born and raised.
What would you say your position in the family is?
I guess head of house, yeah.
Yeah.
No, we don't really
I
have.
do most of the tasks.
We don't really have much with that.
Does your husband have an occupation?
Yes, but he is mostly traveling.
Okay. And you said you work as an accountant?
Yes.
And what are your hours for that like?
Ooh, I'd say I'm supposed to be there from 9 to 5, but I end up working a lot at home
Okay.
most nights and weekends.
And what's your highest level of education?
A college degree in business.
Okay.
Late 40s.
And how would you describe your home environment?
Pretty chaotic, but good. I mean, it's to be expected with a toddler.
Right. Do you feel safe at home?
No, nothing too crazy. We haven't had any. Nothing that like.
Do you have any source of stress? I know you kind of talked about maybe a little bit of stress coming from your marriage. Do you
Yeah.
want to describe that a little bit?
Conflict. He doesn't really help with anything.
Okay.
When he's home, he just sleeps.
Okay.
And then
I know you're running on just Tylenol right now.
All right. And do you have any hobbies or interests?
I used to really like going on hikes, but it's just hard to find the time now.
So, heart disease?
But with the weather warming up, I think I'm gonna try to make time. for it.
Yes. Yes. The weather's been super nice recently.
And I like math.
Okay.
You gotta like math to be an
Yes,
accountant.
I agree.
Sure.
Any tobacco use?
Yes.
Yes.
I do smoke a pack of cigarettes a day.
Okay.
I know it's bad, but
No.
just haven't found my own time to quit.
What is it?
Have you ever tried to quit?
Just kidding.
I quit when I was pregnant with my daughter.
Okay.
That's really it.
Okay. Do you
And during breastfeeding.
do you smoke in the house or outside?
No, always outside.
Okay.
The chronic mucus rejection of the lungs. That's cystic fibrosis.
Any alcohol consumption?
No, you're probably thinking
Very
of
rarely.
Okay. When you do drink, about how many drinks would you say?
2
Two.
drinks, yeah. And that's a couple times a day.
Any caffeine intake?
Yes.
Yes.
A coffee in the morning.
Okay. Do you know about how much that would be?
It's about like 10 to 12 ounces, I'm
Okay.
pretty sure.
And any drug use?
No.
All right, and how would you describe your quality of sleep at night?
It's gotten better as my daughter's gotten older, but with working all night, I'd say I get like 6 hours of sleep. Usually wake up like a couple times a week, once in the middle of the night when my daughter starts crying.
Okay. When you are getting 6 hours, would you say like it's like good quality sleep, or do you struggle to stay asleep?
I don't wake up a lot, but I
Okay.
never feel rested.
Okay. All right, and then what does exercise look like for you?
Sorry.
You're good.
I don't exercise.
Okay. So what does activity look like for you? Like,
Running around chasing my daughter.
yeah.
But I really just sit at a desk or the couch all day trying to do work.
Right. Sometimes I like to just like go on walks. I'll take my daughter on walks too, and that's a really good source of exercise every day. With the weather being nice, you could always try to just go on like a short little stroll if you had the time. That's my favorite thing to do, and also spend time with my daughter.
I'd love to start going hiking again.
Yeah. Okay, and then I'm going to ask you a few questions about your living arrangements. So do you live in a house or an apartment?
It's a house.
A house, okay. How many rooms?
3 bedrooms.
Okay, your daughter has her own room.
Yes. She's downstairs with our room, but as she gets older, she'll move upstairs.
Okay. And does your house have heat and AC? Yes.
It has like all the modern appliances.
Okay. Smoke detectors.
Yeah.
Okay. Any pets?
Yes. 2 cats.
2 cats. And are they indoor or outdoor?
Indoor, but sometimes they like to go into the backyard.
Okay. And you said your house is 2 stories?
Yeah.
Okay.
So I'm currently in my junior year.
And you said you don't have health insurance currently? Okay.
How would you describe your social
So
your
we weren't,
finances?
yeah, we weren't quite.
Do you have a
poor, but
primary
we weren't,
health care provider?
We weren't rich either, you know.
Sorry, say that again.
Do you have a primary health care provider?
I used to, but I really don't go to see her anymore.
Okay. And what is your transportation source? Do you have your
I
own
have
car?
my own car, yes.
Okay.
Partially paid off.
Okay. And have you traveled recently? Any exposure to any contagious diseases?
No?
No? Okay, and then my last few questions are just going to be a little bit about your religion. So you said you don't practice anymore?
No, but I do try to meditate twice a week because we believe that healing is very important
Okay.
when you're ill.
So would you consider yourself a spiritual person even though you aren't currently
Yes.
practicing? Okay. And so do you use meditation to cope with stress?
Yes, and to help with healing.
Okay.
It's really good for the body, mind, and soul.
Do you have any religious or cultural prescriptions concerning medical care?
No, but if I were to get pretty ill, I would want to practice meditation more often.
Okay.
I try to listen to a couple times a day.
You are at 25 minutes, but it's okay.
I'll ask a couple more questions. Okay, and then how would you like me to address or help with any religious needs. You said just if illnesses to progress, allow for meditation. Is there anything else that you would want me to?
That's really just it.
Okay.
If I was admitted, I would try to block out time for me to meditate without interruption.
Okay.
But